Now we're going to start in the US, where there are more than 150,000 confirmed cases, the death toll passing 2,800. More than a third of those deaths have just been in New York State, which is now considered a global centre of this pandemic. Well, this is how the city is dealing with this crisis. This is a field hospital which is being set up in the city's iconic Central Park to help take some of the strain. And this is one of the Navy's hospital ships. It is being called on to deliver humanitarian aid, and as you can see, it sailed past the Statue of Liberty on its way into New York Harbour, carrying 1,200 medical personnel and much needed medical supplies. Well, here's New York City Mayor Bill de Blasio on that.
Coming here to save the lives of New Yorkers in our hour of need. We've all been through a lot these last few weeks, and we needed this boost. We needed this hope.
Well, let's get the perspective from our World Affairs correspondent, Paul Adams.
With America's city streets increasingly deserted, the prospects of a swift return to normality are fading. Officials are now warning of as many as 200,000 American fatalities.
If we can hold that down, as we're saying, to 100,000, it's a horrible number. Maybe even less, but to 100,000. So we have between 100 and 200,000. We all together have done a very good job.
Staggering figures. Now, just as a comparison, the UK is trying to keep its death toll to below 20,000, and China's death toll is currently at 3,300. Well, President Trump says that he expects the US death toll will rise significantly, with the US infection rate tipped to peak in 2 weeks. The president has now extended social distancing restrictions until the end of April, after initially saying that he hoped America could reopen for business at Easter. Here's Kerry ODonnell in Washington.
Yeah, well, of course, the president doesn't describe it as a U-turn, but he has absolutely changed his tune in the last 24 hours. There's no question about that. He was talking about reopening things in time for Easter so that the pews in the churches were full on Easter Sunday. That's gone away, and what seems to have happened is that the scientists on that task force, the now well-known faces of Anthony Fauci and Deborah Birx, seem to have got to the president and have found a way of talking to him so that he understands the scale of it. We're told that they warned him that if there wasn't proper distancing for proper length of time, that more than 2 million Americans could die. More than 2 million Americans could die. Even with the measures in place, the scientists are warning that the death toll could be over 100,000 and perhaps as much as 200,000. So the scale of these things, I think, has now been taken on board to some degree by the president. He's talking about at least the end of April for all of the measures that are currently in place, and possibly the beginning of June. I think at this point in time, we have no idea how long these measures are going to be in place.
Well, New York Governor Andrew Cuomo says that New York is the canary in the coal mine. That's his description. And he says that the situation there will be replicated across the country. Let's go back to Gary again.
The idea that Central Park is an overspill for the whole healthcare system, and that you have to moor a 1,000-bed boat off of Manhattan itself so the system can cope in the most developed country in the world, gives you an idea of the scale of the challenge that they're facing, particularly in New York, which has a quarter of all the country's cases. And they're not by any means at the worst point yet. Certainly the officials there are expecting things over the next 2 weeks to continue to rise, that deaths will continue to rise, cases will continue to rise. They are bracing themselves and they are giving dire warnings that they simply don't have the equipment available to keep people alive, and that people will be dying because there isn't enough ventilators, because there isn't enough protective equipment for the healthcare workers to use to keep themselves safe and to keep other people safe.
Now, you may recall that China actually went into lockdown just ahead of its New Year holiday, a time when millions of people would actually have been travelling around the country. It's a move that is widely credited with helping to limit a wider spread of this virus outside the worst affected areas. In the US, however, authorities declined to take similar measures before the spring break holiday, and this is why it matters. A company called Tectonic's GEO mapped the locations of mobile devices on a beach in Florida's Fort Lauderdale. That blue line is the beach, and here's where all those cases ended up. You can see they're spreading across the East Coast and central US. That's the impact that gathering on just one beach could have on the spread of the virus throughout the country. Well, for more on that aspect, I spoke to Donna Shalala, the former Secretary of Health in the Clinton administration, now the Democratic Congresswoman for the city of Miami.
Too little, too late, but we're going to catch up. We just don't have a universal health care system. We've seen the gaps in that system, but more importantly, we have some of the greatest scientific agencies in the world that were not allowed to do their job. Now they're playing catch up. They've convinced the president that this is serious and that it's not short term, it's long term. We don't have the hospital beds, for instance, that your country has, because we've had a high-tech hospital system that moved to outpatient care. So the number of hospital beds per person is very low here, and accounting for that for people that really have to be hospitalized is one of the great challenges, in addition to all the equipment that we need. So while we have the scientific expertise, we didn't have the distribution systems, the production systems to catch up with this virus, and we started late, but we will catch up, and we will have the discipline to starve this virus.
The perspective there from Congresswoman Shalala in the United States. Let's turn to the UK now, because the number of deaths has fallen for the second day running here. So let's bring up the figures. 180 people have died over the past day. Now, this brings the death toll in Britain to more than 1,400. The number of confirmed cases stands at just over 22,000. Let's get an update from our health correspondent, Nick Triggle.
Now, what's interesting is if you look at back this time last week, the number of deaths, daily deaths, were doubling every 2 days. But over the last 3 days, we've seen 260 deaths announced on Saturday, 209 on Sunday, and then, of course, 180 today. So it is an early encouraging sign that maybe things are going in the right direction. But I would add, in Italy, that have seen the most deaths across the world, they saw the numbers jump around a little bit before they have started to plateau.
Well, the British Prime Minister Boris Johnson is still in self-isolation after he tested positive for COVID-19. Also, his closest advisor, Dominic Cummings, is also in self-isolation now after he experienced symptoms. But the Prime Minister is still holding meetings via video conference, and he tweeted a message earlier on today saying that he's been working from home and continuing to lead the government's response to the virus, adding that please stay at home, protect the NHS and save lives. Well, it looks like more people are generally listening to this message. The UK is now in its second week of those severe restrictions. Here's the government's chief scientific advisor.
Actually, this has been successful in terms of the behaviour changes, and I want to thank everybody for the way in which everyone is adhering to the measures that have been put in place.
Also, during today's daily briefing, the government produced figures showing just how much life has come to a standstill here. If you have a look at the graph, it shows that the change in transport use over the past month is really visible. When you look at the image, which is actually on our website, there is a huge drop in the number of trips which were taken from the end of February. The number of motor vehicles, the use of motor vehicles is in fact actually down by nearly 2/3. And the graph, which is on our website, also shows that travel on the London Underground, the Tube, has seen an even bigger fall. It's down by 95% compared to a month ago. So people are overall listening to those appeals not to travel, to stay at home if they can. Let's go back to Sir Patrick Vallance again.
So the measures are in place, they are making a difference, they are decreasing the contact, which is so important to spread the disease, and we're doing a good job at cutting that down. Now, the reason that's important is because, of course, it then prevents the number of cases, should reduce the number of cases.
Well, the government says that despite this reduction in contact, it still expects to see a spike in hospital admissions over the next 2 to 3 weeks. 20,000 former staff members have now returned to the National Health Service, and also London's biggest convention centre has been transformed into a huge temporary hospital. Hugh Pym has more.
Just a week ago, it was a giant conference hall with room for a dozen football pitches. Now it's a hospital with intensive care beds and ventilators and ready in a few days' time to receive the first patients. The capacity eventually will be 4,000, and if those beds are used, it'll be the biggest hospital in the world.
We'll identify this area.
Simon Stevens, head of NHS England, toured the site at London's Excel Centre today and met some of those who are making things happen.
Today there are over 9,000 positive coronavirus patients in hospitals across England, and we know that number is only going to increase. That's why what you see here is a mass mobilisation taking place right across the country, but also at these new Nightingale hospitals. This has been an extraordinary team effort on the part of nurses and doctors and therapists and pharmacists across London, but also volunteers and paramedics and people returning to help.
The first staff were applauded in today. Volunteers from other hospitals and recently retired doctors and nurses will be caring here for seriously ill COVID-19 patients at what's now called the Nightingale Hospital.
There was Arctic lorries here last Tuesday, Wednesday when I was first here, and now we've got fully ready to take some patients. Now there's still a lot more work yet to be done, but huge progress about building a hospital in London, Nightingale London, in just less than 2 weeks. It is unbelievable.
Now let's have a look at how European countries are coping with this crisis. I want to show you the moment that Hungary's parliament voted to give the Prime Minister there, Viktor Orbán, sweeping new powers to rule by decree. Now this in effect means that the Prime Minister is allowed to bypass Parliament. Viktor Orbán's supporters say that this will help him deal with the virus outbreak, but the law is hugely controversial. It has no time limit. The passing of the anti-coronavirus defence law means that from immediate effect, the Hungarian parliament has suspended itself with no plans for elections to be held. The law threatens jail terms of up to 5 years for anyone found to be spreading falsehoods about the virus or, in fact, the measures taken to control them. So critics have said that this could, in fact, lead to the imprisonment of journalists who criticise the government. But according to a poll by and I have to stress, a pro-government polling agency in Hungary, 72% of the public do support this bill. Our correspondent Nick Thorpe reports.
These emergency powers seem to go further than in many, perhaps any other country of Europe. And the opposition, human rights groups and some international organisations have raised their concerns. They're worried especially over the fact that the powers are for an indefinite period. The Prime Minister himself will decide when the emergency is actually over. The opposition and human rights groups wanted more controls, checks and balances. Those are now seen as being far too weak. And also worrying for journalists in Hungary, independent or critical journalists in Hungary, is a change to the criminal code within this new emergency power of the government, under which those found guilty of spreading misleading or false information could be jailed for up to 5 years. That could have a chilling effect on the work of the independent media here in Hungary.
Well, as Nick alluded there is quite a bit of criticism to this move. The former Italian Prime Minister Matteo Renzi has tweeted that the EU must force Hungary to change its mind on this decision. And if it can't do that, well, he says that Europe will simply drive Hungary out of the Union. Whilst Andrew Stroheim of the Human Rights Watch says that today is the day that an EU member state becomes a full-on dictatorship. Strong words there. But Hungary's government is not the only one, in fact, to increase its powers during the outbreak of COVID-19. We are, in fact, seeing stronger measures being implemented around the world. In Thailand, for example, new laws are allowing the media to be censored, curfews to be imposed, and also the military to be deployed. Well, compare that to Israel. Prime Minister Benjamin Netanyahu there saying that he was set to stand trial on corruption allegations, But in fact, now he has shut down all courts. He's also permitted the tracking of Israeli citizens' phones. And the Prime Minister says that the move will help track individuals who've come into contact with those who contract COVID-19. But critics argue that this could lead to a Big Brother-style society. Well, let's take a look at Spain, because infection rates there do continue to rise. 6,400 new cases confirmed just today. This is the graph which shows that Spain now has over 85,000 confirmed cases, making it the third nation to overtake China in terms of the number of individuals who are infected with COVID-19. Only Italy and the US have more cases. Also, both Spain and Italy now have more coronavirus-related deaths than China. And if we have a look at these images of Barcelona's famous cathedral, well, normally bustling with tourists, totally deserted. This near-total lockdown across the whole of Spain has just become even more severe, in fact. The nation's Prime Minister announcing a lockdown of all 47 million Spaniards. Guy Hedgecoe is in Madrid.
Now, as of today, as you said, non-essential workers are not allowed to travel to their workplace. They also have to stay at home as well. So that's the main novelty. And the government has done that because it says it wants to really make sure that there's no resurgence or no increase in the spread of the virus. It believes that although the latest figures do make for rather harrowing reading, we had over 800 people who died over the last 24 hours because of the virus. Despite those figures, the government says that the virus is coming to the end of its upward curve, that the figures are starting to flatten out.
Guy Hedgecoe there in Madrid. And actually, while the Spanish government says that this outbreak is slowing, there's even more worrying rise in cases among healthcare personnel. Let's go back to Guy again.
One of the big problems has been a lack of medical equipment, face masks, respirators. Yesterday, a plane flew in from the Czech Republic, which had donated 10,000 medical suits to Spain. That reflects the desperation really here in Spain for medical equipment. And it's the intensive care units right now which are under tremendous pressure.
And as concern does grow around the world, in Brazil, President Bolsonaro has been doing his best to play down this situation. He spent Sunday visiting a market. This is on the outskirts of Brasilia. As you can see, well, he's rather ignoring those social distancing measures of 2 metres. And in fact, in a televised address just last week, he blamed the media for creating hysteria and panic. Mr. Bolsonaro has been campaigning to ban lockdown measures, saying that the country's economy cannot stop.
If this total isolation goes on like this, we'll have a serious problem with a brutal amount of unemployment. It'll take years to resolve.
Also, a couple of tweets by the president in which he questioned quarantine measures were in fact removed because they violated the social network's rules. So let's cross over to speak to our South America correspondent Katie Watson, who is in Sao Paulo for us. Katie, so let's start with these particular tweets that were deemed to be so bad that they had to be removed.
So yesterday, Sunday, he spent the morning, as you mentioned, walking around Brasilia, talking to business owners. He's making clear that it's the economy that comes first. That is a very important part of Brazil. And it's true. You know, we've seen these isolation measures. The big concern is what happens to the economy, is what happens to people who have jobs. However, he's, using that as the kind of his main line and flouting public health recommendations. And that's what is believed to have brought down some of these tweets, the fact that he flouted these rules, and you can see in these videos this, there's no 2-meter distancing, there's no keeping any kind of distance. He's talking to people out there and continuing his message really that this coronavirus is a bit of a little bit of flu. It's a bit of the sniffles. That's the translation, the best translation for it really. He's really downplaying what the rest of the world is seeing as an increasingly urgent pandemic.
And Casey, I mentioned earlier the cruise ship Zandam. It's not the only one in the region which is rather stuck. I know you've been speaking to passengers who are on board lots of other cruises. Bring us up to date on the situation.
That's right. Every day I'm contacted by people who say that they're stuck at sea, they're unable to dock. I think, what's happened here in this region is that they've been watching what's happened, in China, in South Korea, closer to home in Europe. And they've seen what's happened and they're like, right, okay, we need to try and stop and put in some drastic measures to try and stop the spread of coronavirus. So we've seen across the region, we've seen in Peru, in Argentina, Uruguay, Colombia, they've had, and actually in Brazil, they've closed the air borders too and some land borders. They've basically, clamped down, not letting any foreigners in, and that includes ports. And of course, there are a lot of cruise ships going around South America, and they've therefore been unable to dock. So I've spoken to a lot of passengers who thought they were coming in down in Buenos Aires or Rio, right far south, and have had to go right back up to Fort Lauderdale, hoping that they can get in. But of course, with the borders closing all the time, they're still unsure whether they will be able to dock, as they've been told. That's the big concern at the moment.